think one of the first things, especially if you're early on in your parents' evolving status, is to have a conversation and figure out who is going to be able to step up in which ways. Um, we have a number of families where there are multiple kids involved. And so, if one person is really good at finance, maybe that person is going to take over the parents' finances. Maybe one person loves to talk to their parents on the phone. So, maybe that person is the one calling every day to check in or every other day. So, figuring out who has which strengths and which way that they are going to best support mom and dad,
Mhm.
I think is one.
Number two, you really need to decide, to Carrie's point, who's going to do what, but more from the perspective of who's going to be the durable power of attorney over finance, who's going to be the durable power of attorney over healthcare. If mom says it's dad and dad says it's mom, if God forbid something impairs both of them simultaneously, all right, then who's the backup? And if it's not memorialized, you don't have enough, there's no backup. And then it becomes the state. Here to have these conversations in advance and be realistic. Okay. If you are the kid who lives far away and there's a kid who lives nearby, chances are it's the kid who lives nearby that's going to go to the doctor more easily than the kid who lives in Thailand. And so when you're sorting out who's going to do what, think about that. The only other thing, Carrie, that I would come back and take issue with, it's not a kid who's going to do the calling every day. Set up a schedule where every kid calls, every other, like a rotation. If there are three of you, you each one of you takes 2 days a week. Okay.
Mhm.
It is one of the things that we see repeatedly, and I've seen in my medical practice, um, is that people get burnt out.